Amy Pierre is coming up, and she's going to be talking how to manage myeloma symptoms and side effects. Go ahead, Amy.
Thank you so much, Kelly. It's a pleasure to be here. And thank you, Dr. McHale and Dr. Voorhees, for those great presentations talking about the nuts and bolts of multiple myeloma. So I'm going to talk a little bit about myeloma itself in terms of its side effects and also the treatments that can cause side effects as well. So we know that both of these things can cause side effects for patients. For example, myeloma cells can increase bone fragility, make you more susceptible to a fracture, causing bone pain. And sometimes its widespread bone destruction can make a calcium leach into the bloodstream, raising calcium levels, which in turn can make patients feel sometimes confused or constipated or even nauseated. And myeloma cells divide and crowd out normal cells in the bone marrow, resulting in anemia that can make patients feel fatigued, weak, even short of breath, and sometimes lightheaded. The overproduction of these myeloma antibodies really suppress normal antibody function, and therefore the immune system itself is compromised, leading to increased infection. And the myeloma proteins can also affect kidney function. The treatment itself can cause a slew of side effects. And you can see here, some of these side effects can overlap between the treatment and the myeloma. But we know the treatment can suppress the blood counts, also known as myelosuppression. Some of these agents can cause peripheral neuropathy, which is numbness, tingling, or pain in the hands or feet. It can affect the bowels, cause diarrhea, sometimes constipation. The treatment itself can be very fatiguing. We can see increased risk of developing clots, also known as deep vein thrombosis, with some of these agents, increased risk of infections and certain type of infections like shingles, and also a slew of other symptoms as well. The first thing I'm going to talk about is steroids. You know, steroids work really well for myeloma coupled with myeloma agents, but it is the drug that everybody loves to hate. As you can see from the slide, it really affects every single body system from head to toe. We can see steroids causing irritability or mood swings. We can see it cause people to have difficulty sleeping, but also giving them a lot of pep and vigor during the day and even during the night too. I have patients tell me that they're up vacuuming all night from these steroids. It can affect the stomach, bloating, hiccups, heartburn, gas, indigestion, cause flushing, weight gain, fluid retention, muscle weakness. It can even cause other medical issues like high blood pressure or people who have diabetes. It can really cause our blood sugars to be out of whack. And for our patients who have prediabetes, it can sometimes push their blood sugar into full-blown diabetes. So how do we manage these side effects? If you're having trouble with the insomnia, we do recommend our patients to take it in the morning with food to see if that helps. Some patients find that if they take it at night with food, the kind of energetic side effects happen kind of right when they need to get up in the morning if they need to get up pretty early in the morning. The stomach discomfort, we really mitigate that with taking with food, but you also need to be on some sort of antacid or proton pump inhibitor to help protect the stomach. And then also opportunistic infections can occur, so you might need to be on agents to help prevent that as well. Fatigue, depression, anxiety, very real side effects. There's one more thing I wanted to mention about steroids, actually, that was just published yesterday. So we know that for some patients who are on long-term therapy, for example, with daratumumab, lenalidomide, and dexamethasone, a lot of clinicians are only dosing the dexamethasone on days of the daratumumab if you're just getting it once a month to avoid some of these long-term toxicities. And also, we were discussing this morning that there was a paper that was published in Blood just yesterday that found that switching older select patients to a lower dose of lenalidomide and discontinuing dexamethasone after 9 months was not only safe, but it also yielded similar outcomes as compared to patients who received continuous lenalidomide and dexamethasone. So we're learning that in certain select patients, we may be able to attenuate that dexamethasone or remove it altogether. So fatigue, depression, and anxiety, this is very real. It can really affect a lot of your quality of life and relationships with other caregivers and family members. And there's a myriad of sources of this, right? It can be anemia, bone pain. It can cause that feedback of fatigue and depression. Not sleeping well can make people feel very tired, and also other toxicity from treatment as well. We know time and time again that the best form of way of treating cancer-related fatigue or treatment-related fatigue is exercise. And you don't have to run a marathon, right? But even just gentle exercise, even with a walking program, yoga, Pilates, anything that you can do that's comfortable. And then for depression and anxiety, it's really important to tap into social networks, right? Support groups, if you may need professional counseling with a psychotherapist or a social worker, and even other holistic versions as well that can help you. Prayer, mindful-based stress reduction. There are certain medications that we can prescribe too. Anti-anxiety drugs or antidepressants can be helpful. Certain supplements too if you run it with your care team. But there's many things we can do to help with these symptoms. So please don't feel like you're struggling alone with a lot of emotional side effects from therapy itself. Infection prevention is key. We know that myeloma patients are 7 times more likely to be infected than the general population, and they have a delayed recovery of infection as well. So a compromised immune system from the treatment and the myeloma is real. So good personal hygiene is very important. Washing your hands really well, taking good care of your teeth, avoiding people who are sick in large crowds. With the COVID era, a lot of people are doing that in itself. So it's making it a little bit easier for myeloma patients to protect themselves because a lot of people are doing these things, but it's still really important for you to do these strategies. If your myeloma treatment is really lowering your white blood cells, specifically your neutrophil count, that's the first line defense against infection, you may be offered growth factor supported injection like Neupogen or pegfilgrastim or Neulasta to boost those neutrophils out of that low level. And there was a study that was published that showed that patients who got an antibiotic for the first 12 weeks of their diagnosis had a lowered infection risk and complications from infection. That utilizing that approach really is an individualized basis. And immunizations are important. All of our myeloma patients should be getting their immunizations, but no live immunizations, of course. We know that only 20% of myeloma patients will achieve protective antibody titers to the flu vaccine and only 30% of the pneumococcal vaccine. So your caregivers and family members around you really need to be vaccinated because they're the ones who are most likely to bring those type of infections to you. It's important to report concerning heralding signs of an infection, such as fever, shaking chills without a fever, or feeling dizzy, short of breath, just unwell, a low blood pressure with a fast heart rate. All of these could be heralding signs of infection and need to be reported immediately to your primary team. Clots can occur, and by clots I mean a deep vein thrombosis, a DVT, or a pulmonary embolism, which is a clot in the lungs, or a PE. The risk of these is high with myeloma patients, but even higher with certain agents such as immunomodulatory drugs, lenalidomide, pomalidomide, thalidomide, and also carfilzomib as well. And risk factors for this are the drugs that you're on, but also certain personal history of clots, family history of clots, or lifestyle. Obesity, a sedentary lifestyle, smoking, other medications can increase the risk. And you need to be on some sort of protection or what we call prophylaxis based on a risk assessment. There are certain tools that we use to kind of calculate your risk. There's several models that are in use for myeloma. It can be determined based on weight or previous clot history or certain medical issues you have like diabetes or mobility. Symptoms of a clot in the leg can be swelling or tightness or pain or redness of the leg. Symptoms in the lungs could be chest pain, shortness of breath, or even feeling anxious with a rapid heart rate, difficulty breathing. This is a medical emergency and needs to be reported right away. So we give you blood thinners to help prevent clots from occurring. But if you do have a clot, we need to have you on full dose anticoagulation, either with warfarin or low molecular weight heparin injections, or direct oral anticoagulants, DOACs. Now that's Xarelto or Pradaxa. And self-management tools are really important, such as no smoking, good weight management, and please, please, please move. It's important to stay active, particularly if you're sitting for a long time. That can increase your risk of developing a clot. GI symptoms also, we can see diarrhea, we can see constipation, and sometimes patients unfortunately fluctuate between the two. The diarrhea can be due to laxatives, the treatment itself, other drugs like antibiotics or supplements. It's important to drink lots of fluids because when you have diarrhea, you're losing a lot of fluids and electrolytes. So it's key to drink fluids, particularly some fluids that have a little bit of electrolytes in them, and avoid things that are going to dry you out like caffeinated beverages, carbonated beverages, heavily sugared beverages. Take anti-diarrhea drugs like Imodiums over the counter. You may need a prescription antidiarrheal if that's not effective, like a modal. Fiber is important for both diarrhea and constipation. And if you're having a lot of diarrhea related to, say, lenalidomide, that's uncontrolled with something like Imodium, it may be related to bile acid malabsorption. So Welchol may be an agent that's appropriate for you to help with diarrhea associated with lenalidomide. Now, constipation can be from medications like opiates or other medications like antidepressants or supplements. So fiber, fluid, and sometimes laxatives can help with constipation as well. What I like to talk about next is understanding your kidney function, because we know that myeloma patients are at risk for kidney dysfunction. Those myeloma proteins get released in the bloodstream and filter through the kidneys and the urine and cause kidney damage, make it sluggish. And so having a high free light chain burden, high calcium levels, that can be really toxic to the kidneys as well. Other medical issues such as diabetes, dehydration, infection, we don't feel well, we don't drink enough, and that can in turn affect the kidneys. And certain medications are quite toxic to the kidneys. Non-steroidal anti-inflammatory drugs like NSAIDs and IV contrast is extremely toxic to the kidneys. So drink, drink, drink. I always tell my myeloma patients you should be sipping on water constantly and avoid certain medications that can be toxic to the kidneys. And how do we treat this? We'll flush it out with hydration, oral hydration, IV hydration. If the underlying issue for your kidney dysfunction is the myeloma, treating the myeloma will help. And if your kidney dysfunction is quite severe, you may need dialysis to help your kidneys function improve. Now, the myeloma cells, as we talked about, can affect your bones. Bone damage, because the myeloma can activate these cells called osteoclasts, which can destroy bones, make the bones brittle, can cause fractures, these lytic lesions, and cause bone pain as well. So we use bone strengthening agents such as Zometa, Iridia, or even denosumab to help prevent further skeletal events from occurring, because we know approximately 85% of patients can develop bone disease during their disease trajectory. So it's really important to report any sort of new bone pain that's occurring to your provider so we can investigate it and see what's going on. Now, peripheral neuropathy, as we talked about, is one of the most challenging side effects and one of the most dose-limiting side effects associated with thalidomide, bortezomib. So we really need to be on top of this. And what does it feel like? It can be a numbness, a tingling, a prickling sensation in your hands or feet or your extremities, which is your limbs. Some patients can say it's cold sensitivity. Some patients say it's an altered sensory, such as they feel like they're wearing gloves and they're not, or they feel like they're walking on rocks, or they're wearing socks and they're not. So it can manifest in several ways, or a burning pain. You never really want to get the symptoms that severe. The best way to treat peripheral neuropathy is to prevent it, right? So we know with bortezomib, changing the dosing schedule. So giving bortezomib once weekly versus twice weekly can lessen the risk of peripheral neuropathy. And giving bortezomib as a subcutaneous injection versus an infusion can lessen the risk of peripheral neuropathy as well. We also know that there's certain supplements that may be helpful, but there's a lot of prescription medications that can help with peripheral neuropathy symptoms. But really the best way to manage it is to dose attenuate those drugs that are causing it, either dose reducing or even holding to allow the peripheral neuropathy to get better. So the IMF has several sources to help you. As you can see, if you go to our website, we have lots of pamphlets that are full of resources talking about all these medications, even pamphlets talking about clinical trials, understanding your labs, understanding bone health, translated in multiple languages. We do have our new Empower Charlotte myeloma website to take a look at. We also have our Ask Dr. Dury series, which is really great for patients. And we also have our phone number to call. So we're there for you, and for anything you need, for any questions or your concerns, there's a slew of resources available for you as a patient and a caregiver.